Welcome to our channel Quaint Cosmos. Today we are discussing heart bypass surgery in this video. So heart bypass surgery, this is recommended by doctors in only last case. Last case means when medications are not enough, when lifestyle changes are not enough. Only in that case doctors recommend this surgical procedure known as heart bypass surgery. And in medical sciences, this is also known as CABG, that is a coronary artery blockage grafting. Okay, so what is done actually in this procedure, and in which case this becomes necessary? Fatty deposits can build up in your arteries. Fatty deposits can build up in your arteries, and that may cause coronary artery disease. In short, this is known as CAD, coronary artery disease, which may lead to different problems like chest pain, which is also known as angina, shortness of breath, then heart attacks in severe cases, especially if blockages are there in your arteries. So different problems are there. So normally initially what happens, initially doctors prescribe medications, they ask you to go for exercises, they ask you to change your lifestyle, okay. But if these things fail, if these things are not working well, only in that case, that means you can say that in the last case, doctors recommend to undergo this surgical procedure known as heart bypass surgery or CABG, coronary artery blockage grafting. So what is done in this medical procedure, in this surgical procedure? First of all, so blockage, say for example blockage is there in your artery and the blood cannot flow to your heart properly, because you know that your heart needs oxygen rich blood, and it should flow properly. Not only oxygen rich blood, the flow rate should be proper according to the requirement of your body, of your heart. So if blockages are there, if problem is there in your arteries, if you are suffering from coronary artery disease, in that case that artery need to be bypassed. That artery needs to be bypassed. Means a new path is chosen by the doctors, and through that new path blood flows. So what is done in this surgical procedure actually? So for the new path, a new artery or a vein, if the vein can do the same thing. Okay, the vein can do the same thing. So the required vein or the required artery is taken from your body, either from your chest or from your leg, again from your arm. Okay, the required vein or the artery is taken from your body, and then that is placed where that is placed, just before and up, just above and below the blockage. Means the new vein, the piece of new vein or the piece of new artery, one end is connected above the blockage and the another end is connected below the blockage. And that way what happens? Blood starts flowing through the new path. Blood starts flowing through the detour or the new path or new route, just bypassing the blockage. So this way blood flow becomes proper to your heart. So that way the surgery is done. This surgery is done in 3 different ways, depending upon the patient's condition, depending on the doctor's surgeons or doctor's expertise. Okay, such as traditional on-pump CABG. On-pump CABG, that means in that case what happens actually, your heart is temporarily stopped by using medications. Your heart is temporarily stopped, and instead a heart-lung machine takes over the function of the heart. Okay, takes over the function. By who? By what? By using a heart-lung machine that takes over the function of your heart during the surgical procedure. So that is known as traditional on-pump CABG. Why traditional? Because in most of the cases, this surgical procedure is followed. Next one is off-pump. So in case of off-pump CABG, in that case, heart remains beating. Okay, means in that case, heart-lung machine is not used. Heart remains beating, and in that case, surgical procedure is followed, means surgery is done. And one more way is there, just to make a small incision on your chest, and that way surgery is done. So in that case, there is no need to fully open your chest. So that becomes a less invasive procedure, and that is good for the patient since it is less invasive. Okay, so these ways heart surgery is done, means heart bypass surgery is done that way. But problems are there, means risks are involved after the surgery. Okay, first of all, you need to consume only heart healthy diets. You need to avoid cholesterol enriched foods. Okay, means you have to take care of your diet. Everything will be recommended by your doctor. Everything will be recommended by your doctor. Anyway, you need to take heart-friendly diet. So in that case, what do you need to do? You have to avoid cholesterol-enriched foods. You need to avoid processed foods. Just after the surgery, actually in hospital, you need to stay over there 4 to 7 days for initial monitoring. Monitoring is required. So for that purpose, you need to stay for a few days, just for 4 to 7 or 5 to 7 days in hospital. Then you have to follow the recommended food by the doctors. You have to take proper prescriptions. Doctors normally prescribe statins, blood thinners, beta blockers, etc. Okay, doctors prescribe all those things. You have to take all those medications regularly. You need to keep your stress level minimum, because if stress increases, in that case your blood pressure increases, and that is not good for your heart. So different things are there. Everything will be recommended by, everything is actually recommended by doctors, and you have to follow all those things carefully. You have to follow all those things very seriously, very carefully, all those things. Because this surgical procedure is not this surgical procedure is actually very serious. Okay. So you have to be very serious about the recommendations by the doctors. And in but one thing you should keep in your mind that no doubt this is a life-saving solution. This heart bypass surgery is a life-saving solution, there is no doubt. But this is not the full cure of your problem. Again, there may be problems. Even after the surgery, again, there may be problems. So you need to remain cautious about everything. Again, blood clots may form. Again, heart attack can happen. So you need to do exercises regularly. I have already mentioned something about foods. Okay, only heart healthy foods. Then you should quit smoking. Okay, so risks are involved, and this is not the full cure of your problem. Means just don't think that you have undergone surgery, you have undergone heart bypass surgery, that means everything has become like previous one. Means your previous health condition was very good. So it has you have overcome all the problems by undergoing this surgery. Don't think like that. You have to you have to remain very cautious. And if doctors prescribe you medications, then you have to take all those medications carefully. Don't miss any medications. Anyway, aim of this video is not to diagnose your problems, not to treat your problem, just give you a basic idea about how this surgical procedure is followed. But one thing, if doctors recommend this thing, you should undergo this surgical procedure. Because normally in the last case, when medications don't act properly, means when medications are not enough, when your lifestyle changes are not enough, only in that cases doctors recommend this. So you should not avoid this surgical procedure. If you don't have a proper idea about medical sciences, only in that case. And if you have already got expertise in this field, then you can choose yourself. You can take your own decision. Anyway, so this was all about it, today's topic, heart bypass surgery, and this is also known as CABG, because one graft is used here, and in many cases, not in many cases, I should rather say that in some cases, one bypass surgery is enough. In some cases, 2 bypass surgery may be required. In some cases, 3. In some cases, 4. So known as triple bypass surgery, quadruple bypass surgery. Means how many blockages have been treated this way. Depending upon that, names are given like that. Anyway, so this was all about today's topic, and this is the end of this video. Thank you for watching this video.